Welcome everybody to our channel today. My name is Sarah McLean and I'm the founder of Project 31 and Executive Director, and this is Jennifer Harrod. She's our certified breast care nurse, and today we're going to be talking about what is a survivorship care plan. I don't know if you guys have even heard that term. I know that as I went through my journey, I didn't even know what that was. So our goal this year is really to have Jennifer teach us about what it is, why we need one, and what the benefits are. So let's just start off with the basics. What is it?
Sure. Well, and I'd like to start off with what is survivorship? What's the actual definition of survivorship? Because I think it differs and so many people don't really know what the true definition is.
Well, honestly too, because a lot of people will say, well, I don't consider myself a survivor, or even people when they are is it when you're first diagnosed? Is it when you're in treatment? Like, when do you become a survivor? So
Right. And it starts when you are first diagnosed, you are a survivor. Mm-hmm. The National Coalition for Cancer Survivorship defines cancer survivorship as the state of living with the many challenges that come with a diagnosis of cancer, from the time of diagnosis for the balance of your life.
Mm-hmm. So as you're going through your treatment, you're a survivor. And every day that you're alive, you're a survivor.
Correct. So a survivorship care plan is not something that is required of every hospital or every doctor. Some doctors do fill them out. If they don't, I like to encourage people you can print one off, just a basic one. I can show a template, to take it to your doctor, to have them fill it out, because it is a cancer treatment summary. It's a follow-up plan. It's used to keep up with your health care and to keep up with your health care records, to share your records with your primary care provider, with your other doctors that may be following you along on your journey. And it's a summary of your care. So it's not a detailed record of your care,
okay,
but it gives you a good summary of what have you had done, what surgery have you had done, how big was the tumor, where was it located? Did you have radiation? If so, how many treatments of radiation? Did you have chemotherapy? What chemotherapy did you have? And what should you be looking for as far as, are there any complications that could happen later on down the road, as far as complications to cardiac, anything such as
bones.
that. Exactly. Mm-hmm. So it also is a good thing to have that will tell you what follow-up care do you need after you're done with all of your treatments. If you've had a double mastectomy, do you need a mammogram? Mm-hmm. Some people don't get told that.
Right.
So no, you don't. You do a chest wall exam. But just knowing what your follow-up care should be is very beneficial, not only to help the providers out so they know and you can hold them accountable to what your care needs are, but also it gives you peace of mind.
Right.
If you have that peace of mind that I should be following up in 6 months for my chest wall exam, or I've had a lumpectomy, should I be following up for a mammogram, and if so, how often? Having that basic knowledge is it empowers you.
Right. So you had mentioned something. You said it's not a standard of care at this point.
Correct.
I feel like the medical community is moving towards that, but unfortunately not a lot of hospitals have a survivorship care team, or anyone being proactive necessarily. And so that's why we wanted to be intentional about just helping you guys understand that it's necessary. So another question I had as you were talking, okay, for example, I didn't have chemotherapy, and some women don't even go to an oncologist.
Right.
Should they be asking their surgeon for the survivorship care plan? Who would be the person in that scenario?
Right. That would be your surgeon, because they would be the primary caregiver for you.
Okay.
And they would be able to fill out the paperwork, fill out the care plan, give it to you, and then they will communicate it with your primary care doctor, or you can.
Okay.
But having that helps to have that continuation of care, because I think there's that loss of communication between your primary care provider and who is responsible for the follow-up care.
Mm-hmm. Well, yeah, because like you had told me, really, I call my oncologist for a lot of stuff. My medical oncologist, she's like, you really should be calling your primary care. And I was like, but they don't know everything,
Right.
But really, once you're finished with active treatment, is that you need to transition over to primary care, or I mean, if you're metastatic, you need to continue to carry on with your
Correct.
medical oncologist.
You'll continue to carry on. Your primary care provider should be an intricate part of your care while you're under the care of your medical oncologist, as well as afterwards. They need to be kept in the loop. Quite often, though, they don't know.
Right.
No, they don't know what you've had, what follow-up you should have. So if you have that written down from your medical oncologist, and you can give that to your primary care doctor and say, these are the things I should be having done. If you're doing a chest wall exam, having that by your medical oncologist or your surgical oncologist, either one of those can help with that, because your primary care doctor may not be familiar with that.
So in addition to the chest wall, so let's say somebody's double mastectomy and they're doing surveillance, which would be like your follow-up care. So we want to do the chest wall exam, but do we also need to be doing MRI as well, or?
They actually at this time don't recommend that.
Okay.
Unless you feel something or you notice something that's abnormal. So get to know your body, get to know your chest after you've had that mastectomy, and get to know if there's any spots that feel different. Mm-hmm. If you have any new pain, swelling, talk to your doctor about that. They may do an ultrasound, they may do an MRI. Mm-hmm. I've had both of those done.
Yeah.
And that's okay. That's what it's used for at that point.
Well, and I know also for myself, continuing to do self-exams. Even if you've had reconstruction, if you haven't had reconstruction, you need to continue to do the self-exam. That's how I found the second tumor, just from doing that myself personally. And then also having, like you said, any changes. Like I had fat necrosis here, but it felt like a lump. So you call in, go for ultrasound. Right. They're able to tell you pretty quickly that it's nothing. But again, being intentional and staying proactive long term. Another question that I was thinking about, so we're at the end of everything. How do you get the plan?
Sure. So if your provider does not provide you with one, if they don't have a survivorship care team, then, and often right now, it's the hospitals, quite honestly, they're trying to deal with the active treatment. Mm-hmm. So your care team's trying to deal with the active treatment, and they don't always have a great survivorship team. They just don't have the manpower and the staff to do it right now. And that's why it really falls back on us as the survivor at this point. You can always go to, so ASCO is the American Society of Clinical Oncology. Mm-hmm. They have partnered along with cancer.net, and they provide a wonderful free template. And it is the treatment summary and survivorship care plan for breast cancer.
So what was the link that they need to go to?
So you can go to cancer.net, and there will be a tab for survivorship, and then there'll be a tab for follow-up care after cancer treatment. Okay. And you will see the care plan there. There are others out there. This one, to me, is one of my favorites, just because they have specific ones for breast cancer, for GYN, different types of cancers. So it will have on there the different types of chemotherapy that are specific for, and it has the different follow-ups. It also has on there, are you estrogen positive, negative, HER2 positive, when you were diagnosed, what surgery date you had, if you had lymph nodes removed. Then it also will go over things such as the normal side effects that you may experience from your aromatase inhibitors. So that way you kind of have an idea of, is this normal, is this not? And you can talk to your provider about that. It also goes over your familial cancer risk assessment, if you've had that done, if you've received.
So like genetic testing.
Exactly. And then it goes over a follow-up care plan, and it has on there when to contact a doctor. If there's anything that represents a brand new symptom, a persistent symptom, anything you're worried about that you may be concerned that the cancer is returning. And then it has on there, the provider should write if you need a mammogram, if you need an MRI breast, and different who the doctors should be that are ordering that and who should be following up. And to have that oncologist just write that down for you to give you an idea, because then it puts ownership as to who's responsible for this.
And it gives us, like you said, empowerment, because I feel like once we get to the end and we transition into our new normal, we feel powerless, you know, like you feel lost a little bit, because you're like, you've been through all this stuff, but now I'm like, I don't know what to do. I don't know what I'm doing. I was also thinking, in addition to that, you know, as we transition or as we're moving forward in our journey, what about wellness? Is there anything on there about testing our blood to see where our levels are? Because I know, like for myself, I had to be proactive by myself just to see what's my B12, D3, iron, all that. I was anemic because I had lost so much blood, things like that. Like, is there anything like that to, because if you're feeling fatigue or maybe tightness and you have lymphatic problems and you just don't know, like, is any of that on there?
On here, it goes over some typical breast cancer survivors may have issues with. And so it tells you different things, such as fatigue, anxiety, depression, memory loss, things such as that, sexual functioning.
Oh, yeah.
So that way, any of those that you may go, oh, you know, I'm having issues with these, when you need to contact somebody, so that you should reach out, because those are not normal side effects that you should have to deal with. You know, there are things that can be done to help you with those. And then it goes over lifestyle things that we can do to improve our lifestyle, to improve maybe our diet, to improve exercising so that we're getting the exercise that we need. It doesn't necessarily go over your B12, your D3, but your primary care provider, having that conversation with them if you're feeling more fatigued than normal.
Right.
They should be running those panels and checking to see what's going on.
Right. Well, you know, we're going to continue this conversation. This year, Jennifer is really going to be intentional about teaching us about all the benefits of a survivorship care plan, why we need them. In addition to that, all these other things that we need to be kind of aware of as we move into our new normal. So we're excited about just giving you guys some tools and really being proactive about education, because that gives us empowerment. So if you guys want to subscribe to our channel and like it, we'd really appreciate that. We are excited about continuing just to give you guys some tools. We hope that'll be beneficial for you. So thanks, Jen.
Thank you.
And we'll see you guys next time.
Bye, guys.